patient privacy. Hi, my name's Chloe. I'm going to be your nurse today. Can you confirm your name and date of birth?
Brock Hughes, August 23rd, 2002.
Okay, and checking your bracelet, it seems that is correct. And do you have any allergies?
No allergies.
Okay, perfect. So we're going to be doing a full head-to-toe assessment where we're just going to be looking over your general body systems, noting anything abnormal. It should take only about 10 to 15 minutes. Do you have any questions?
Nope, no question.
Okay, thank you for your time. So looking at the overall appearance of the patient, he appears to be in good posture, not slouching. His mood appears to be appropriate. He's not grimacing or in any sort of physical pain. Are you in any pain right now?
No pain right now.
Okay, perfect. And looking at the patient's hygiene, he appears to be well groomed and no foul odors are noted. And I see no lines, drains, and tubes attached to him. Okay, so now we're gonna go over like your neurological system, and I'm just gonna ask you a couple questions. So can you tell me where you are right now?
I'm at the doctor's office.
Okay, and can you tell me what day it is?
It is April 13th.
Perfect, and can you know what year it is?
It's 2025.
Okay, and who is the president?
Donald J. Trump.
Okay, perfect. So the patient appears to be alert and oriented ×3. His level of consciousness appears to be intact. And so can you smile for me? Okay, his smile appears to be symmetrical and his speech doesn't appear to be slurred. It appears to be coherent. And I'm just gonna assess your strength of your upper and lower extremity. So I'm gonna have you pull me towards you. Okay, now pull me away. Okay, and now push your feet like a gas pedal. Perfect, and then flex the other way. Okay, awesome. The patient's strength in his upper and lower extremities appears to be 5 out of 5 strength. Was there any pain when you were doing that?
No.
Okay, now I'm just gonna assess your senses. I'm gonna have you close your eyes and tell me where I'm touching you.
Left shoulder, right wrist, left knee, left shin, right shin.
Perfect. So the patient's sensory to touch appears to be intact. Was there any pain or discomfort with that at all?
No, no pain.
Okay, so now I'm just gonna kind of assess the skin on your face and your ears and your eyes. Do you use any hearing aids?
No hearing aids.
Okay, what about contacts or glasses?
No contacts or glasses.
Okay, can you read my badge?
Chloe SBS Institute.
Okay, perfect. And now I'm just gonna assess the skin on your scalp. So looking at the patient's scalp, he doesn't appear to have any lesions, nodules, or any infestations on his hair. And so now I'm just gonna look at your ears. All right, looking at the ears, they appear to be appropriate in shape and size, and no drainage noted on his ears. Perfect, and now I'm just gonna look into your eyes. I'm gonna have you look just past my shoulder and look straight. All right, and now I'm gonna have you follow my pen light. Right. Okay, pupils are equal, round, and reactive to light and display accommodation. Now I'm just gonna kind of look at the skin in your eyebrows and your eyelashes. All right, no drainage. Perfect. Now I'm gonna have you kind of tilt your head back and I'm gonna look in your nose. All right, patient appears to have a patent airway. He doesn't appear to have any nasal polyps, any abnormal drainage. He does appear to have a deviated septum. Do you have any trouble breathing when it comes to having that?
Not really.
Okay, sounds good. Now I'm just gonna have you open your mouth for me. All right, patient's oral mucosa appears to be pink and moist. His tongue is midline and appears to have good oral hygiene. Okay, awesome. Now I'm just gonna go down to your cardiovascular system. So I'm gonna just test your capillary refill on your fingers. All right, patient's capillary refill is less than 2 seconds on his upper extremities. And I'm just gonna take off this one sock and look at the capillary refill on your lower extremities. Right, less than 2 seconds. All right, and less than 2 seconds bilaterally on your lower extremities. And now I'm just gonna assess your radial pulse. All right, radial pulse is equal in strength bilaterally and is present and equal and +2. Now I'm just going to assess your brachial. Okay, patient's brachial pulse is present and equal bilaterally in strength and +2. And now I'm just going to assess your pedal pulses. All right, patient's pedal pulses are equal in strength bilaterally. Now I'm just going to do some more hand hygiene. Okay, so now I'm just going to have you look to your right and kind of lean your head back a little bit, okay? And then look to your left. Okay, awesome. No jugular vein distension is noted. And now I'm just going to palpate your carotid artery. All right, patient's carotid artery is equal in strength bilaterally, +2. And then I'm going to listen to your carotid artery and then your other heart sounds, okay? And you just have to breathe normally for me. Right, no bruise noted on his carotid artery, and now I'm just going to listen to your other heart sounds. And you just continue to breathe normally for me. All right, patient's heart sounds are present, and I heard the S1 and S2 sounds, and I heard no murmurs, gallops, or rubs. And so now I'm just going to assess your respiratory system. So looking at the patient's respiratory rate, it appears to be clear and unlabored. The patient doesn't seem to be in any respiratory distress, have any increased work of breathing. The patient also has no retractions present, and his chest expansion, it seems to be symmetrical with no barrel chest or pigeon chest. And now I'm just going to listen to your lung sounds, and every time my stethoscope hits you, I want you to take a deep breath for me, okay?
All right.
All right. Patient's lung sounds were clear and equal bilaterally, anteriorly. And so now I'm just going to have you raise up your right arm, and I'm going to listen to your middle lobe on your right lung. Okay, perfect. And his middle lobe on his right lung was clear and equal as well. And so now I'm just going to have you turn that way, and I'm just going to listen to the, just kind of, yeah, there you go. So now I'm just going to listen to your lung sounds on your backside, and just take a deep breath. Okay, perfect. You can sit facing towards me again. So listening to his lung sounds posteriorly, they appear to be clear and equal bilaterally, and all his lobes anteriorly, posteriorly, and midline had no cracks, bronchi, or wheezing. So now I'm just going to go down, before I go down to your abdominal system, or your abdomen and your renal system, do you have any coughs or like sputum that has been concerning you recently?
No.
Okay, perfect. So I'm just gonna have you lay down, and we're just gonna go down to your abdomen. All right, so I'm just gonna start with some questions before. How often would you say you urinate a day?
Maybe 4 times a day.
Okay, and when was the last time you urinated?
Maybe an hour ago.
Okay, and was there any problems with the color, odor, consistency?
No, there's not.
Okay, and with your bowels, how often would you say you had a bowel movement a day?
Maybe twice.
Okay, and when was your last bowel movement?
This morning.
Okay, awesome. So I'm just gonna have you lift up your shirt for me. Okay, so observing the abdomen and the skin on the abdomen, it appears to be appropriate for the patient's ethnicity. No obvious distension or pulsations or masses present. And the patient appears to be in good hygiene, and no foul odors are detected. So I'm just gonna auscultate and listen to your all 4 quadrants, okay?
All right.
Alright, patient's bowel sounds are present and normal active in all 4 quadrants. And so now I'm just going to palpate all 4 quadrants on your abdomen, and you're just going to tell me if you feel any pain or tenderness, okay?
All right.
Alright, did you feel any pain or tenderness?
Nope.
Okay, there was obviously no guarding or rigidity noted upon palpation. Yeah, and you can lower your shirt. Okay, perfect. And so now you can go ahead and sit upright. All right, and now I'm just going to go over your musculoskeletal system and your range of motion. So I'm going to have you look to the left and the right of you. Okay, perfect. And then look up and down. All right, and then I'm going to have you touch your toes, lean forward and touch your toes. All right, and you can come back up. So the patient's range of motion on his neck and spine appears to be intact. Was there any pain?
No pain.
Okay, now I'm just going to assess your range of motion in your upper extremities. All right, patient's range of motion on his upper extremities are intact. Was there any pain with that?
No pain.
All right, and I also noted no crepitus on his joints and his upper extremities. And now I'm just going to test the range of motion in your knees and legs. So go ahead and straighten your leg. Perfect. Straighten this leg. Right, patient's range of motion is intact on his lower extremities, no crepitus in the knees. Was there any pain with that?
There's no pain.
Okay, and now I'm just going to have you stand up and walk towards the mirror, and then just walk back and sit down. All right, patient's gait appears to be appropriate. He appears to be moving in a heel-toe motion. And was there any pain with that?
No pain.
Okay, awesome. And as I was observing you throughout this assessment, I was looking at your skin. I'm going to feel for the temperature on your upper extremities.
Okay.
All right, the patient's skin on his upper extremities appears to be warm and dry. And the patient's skin on his lower extremities appears to be warm and dry as well. I see no obvious lesions, scarring, edema, or pallor noted on his skin. It appears to be appropriate to his ethnicity. And so now I'm just going to assess the skin turgor on your arm, just noting any tenting. All right, no tenting noted when testing for his skin turgor. So do you have any questions before I leave?
I don't think I have any questions.
Okay, thank you so much for your time. And hand hygiene, and then curtain.